Hello students, I will show a common, very important clinical sign when you examine a swelling, clinical sign or a clinical test. That is very, very important because all of you know that most of the swellings you can clinically diagnose in 80% or more than 80% of cases if you know proper history taking and examination as such. So this test is very, very important, especially in a cystic swelling. So what is this sign or test is? Look at that. Here somebody is putting the torch. Probably this you can see the illumination here in the scrotum, and probably next is going to put the transilluminal scope close to the fluctuation. Now, if so in the abdomen we can't fix the swelling, we cannot elicit fluctuation in the abdomen. In a hard swelling it may be difficult. In very deep swelling it may be difficult. In a small swelling, fix the swelling like this and indent over the summit. Then you can feel the indent fluid movement. That is called a phases test of fluctuation for in small swelling. Once you elicit the fluid movement, always next thing you have to do is immediately next thing clinical test you have to do is a Transillumination test. Illuminate a bright torch, then see the illumination. You can always in a large swelling you can see through a Transilluminal scope, and you can see illumination within that. So if it is illuminant, transilluminant, that means fluid is fluid nature is clear fluid. So you will have a differential diagnosis what are conditions which have got a clear fluid with the cystic in nature. So that is how exactly this clinical methodology goes to have a final clinical diagnosis as such. So it is done in ideally in dark room. That's important. Ideally in the dark room with a pen torch to illuminate across the swelling, and it's observed using transilluminal scope. Already told transilluminal scope, and it is done in a cystic swelling. It suggests fluid content of the swelling is clear. Fluid content is confirmed by fluctuation test. I saw in two directions, already told. So once you do fluctuation, if swelling is fluctuant, next test to be done is always Transillumination test using a pen torch. That point always you have to remember as a clinician. So swelling which are brilliantly transilluminant are hydrocele. Not every hydrocele need to be brilliantly transilluminant. Commonly hydrocele is transilluminant because it contains clear fluid, with certain exceptions, long-standing hydrocele, thick scrotum, thick sac, and lymph if it contains, infected fluid if it contains, ranula in the oral cavity, and cystic hygroma in the neck, epididymal cyst in the scrotum, meningocele in the skull and spine. So these are the swellings which are brilliantly transilluminant, which you remember it is usually MCQ question, except which is not there, all those things, or Viva they will ask, that also you have to remember what are swellings which are brilliantly transilluminant after once you do the transillumination test as such. So this is a brilliant transillumination. Look at this. Look at this, so brilliant, it's red bright. You should do it in the dark room. It looks so nicely. So brilliantly transilluminant swelling, you can see that so nicely it is. So this is the brilliantly transilluminant swelling. So these are the conditions which you remember. So very common test which you have to always remember. So please for this how to do, go through my clinical methods in surgery with all video lectures of clinical examination, SRB clinical methods in surgery, and also in detail about different conditions about test types aspect. Go through my SRB manual of surgery current edition with the MCQs, with the clinical scenarios, and test details, current edition, and of course operative procedure. If you want to know, go through my operative surgery book, and technique skill you can go through my tissue class of the tissue approximation, and with videos, of course all these lectures along according to CBM syllabus, and operative surgery, X-ray, specimens, instruments, clinical examination methods, everything is there in the DigiNow through JP Publisher, DigiNow lectures entirely. So you can always subscribe that one also to have a better idea. So students, I hope you have understood this important transillumination test very clearly. Thank you very much.